The Nonpartisan Congressional Budget Office's newest score of the Republicans' American Healthcare Act determined that the bill would leave 23 million more people uninsured if the bill is in fact codified into law. Now, surprisingly, this score of the AHCA is actually slightly more kind to it than the last iteration of the bill, but nonetheless, that's still a problem. If 23 million more people will be uninsured, that's a huge issue. However, I'm willing to bet every dollar I have that Republicans will actually boast about this and say, well, you know, less people will be uninsured under this iteration of the bill than the last iteration, so maybe we should pass it. So, according to The Hill, the total is slightly less than the CBO's accounting of a previous version of the bill. The CBO also found that an amendment allowing states to waive certain regulations would mean premiums would be somewhat lower than in the previous version of the bill, and slightly more people would get coverage because they are buying plans that cover fewer healthcare services. In states that let insurers charge sick people more, some people with pre-existing conditions would lose coverage because they could not afford the premiums, despite extra funding provided in the bill meant to mitigate that, CBO said. So let's kind of break this down, because what they're doing at the state level in rolling back regulations is ensuring that more people would get insurance, and while that's technically true, the bill fails to take into account the quality of care. So you'll pay money for some coverage, and you'll be able to say that you're covered, but in actuality, you're not really getting your money's worth, and this will create a race to the bottom, because insurance companies will advertise affordable healthcare plans starting at $49.99 a month, for example. But they won't tell you about the stipulations on what's covered, and that might not cover anything meaningful. And furthermore, the fact that this bill allows insurance companies to discriminate against people with pre-existing conditions means that people that need care the most won't be able to get it. So what they're doing by allowing states to roll back regulations from the Affordable Care Act is it allows insurance companies to dupe people over even more, and they may think they have insurance, but when they actually have to go see a doctor, they'll realize that they were paying for nothing because it will cover literally nothing almost. So this is one of the worst so-called healthcare bills that I think has ever been created, and it's worse than the last iteration in spite of the CBO estimate because of what it allows states to do. Now, Bernie Sanders articulated everything that I feel about this pathetic excuse of a bill, and he said it perfectly.
We can call this legislation whatever we want. You can call it a destroy healthcare bill. You could call it a tax break for the rich bill, but we should not call it a healthcare bill, because I have never seen a healthcare bill which throws 23 million Americans off of health insurance. That's not a healthcare bill. It's not a healthcare bill when you cut Medicaid by $800 billion, denying health insurance to children or some of the poorest people in this country, or middle-class people who need help with nursing home care for their parents. It is not a health care bill when you defund Planned Parenthood and deny 2.5 million women their choice of health care providers. It is not a health care bill when you force older workers to pay 2, 3, 4 times more for the health care that they currently get. So call it whatever you want, but please do not call this bill a healthcare bill.
It's not a healthcare bill. He's 100% right. You know, even though it concerns healthcare, you can't call something a healthcare bill if it takes healthcare away from people. I think that's a misnomer. What we really should be calling this is an anti-healthcare bill, because by referring to it as a healthcare bill, there's this implication that it's going to be giving people healthcare and increasing access to people that want healthcare. But that's not going to be the case. By allowing states to determine whether or not insurance companies can discriminate against people with pre-existing conditions means that people would die. And if people die from a bill, from a so-called healthcare bill, then that's not a healthcare bill. That's an unmitigated disaster that we have to fight. Now, thankfully, Bernie Sanders is fighting for us, and he has a plan that might actually get this bill killed.
As you know, on the reconciliation, the Health Committee is required to save at least $1 billion. It is very possible that the new bill does not meet that basic requirement because of the high-risk pool and stabilization amendments that were added to the bill. It is possible that, in fact, that bill may cost the Health Committee some $28 billion rather than save $1 billion. And if that's the case, reconciliation is not process they could use.
But the question is, what exactly does that mean? Well, Politicus USA explains, Senator Bernie Sanders pointed out that if the American Health Care Act does not meet the requirement for the Senate Help Committee to save $1 billion, reconciliation can't be used to pass the bill, and it will require 60 votes to get through the Senate. It may sound like legislative jargon, but this is a big problem for Republicans. The healthcare bill has to save $1 billion. If it adds to the deficit, as Senator Sanders suggested that it might, the bill will be effectively dead in the Senate. Now, this is really important because it's going to be a challenge for Republicans to even muster the 50+1 votes. But I mean, if they are required to get 60 votes, this bill is effectively dead on arrival. It's just not going to happen. So what we can do now, and what I think would go a long way, is if everyone were to call their senators in their states and let them know to vote against the AHCA, because in the meanwhile, I mean, the vote is coming up. We don't know when specifically at this point, but if you call your senator and let him or her know that this bill would be a disaster, that you would be harmed by this bill, then you can make a big difference. I mean, phone calls to politicians makes a difference. Not much people believe that, but if you ask politicians, if you ask people like Keith Ellison, they'll tell you that there is value in doing this, real instrumental value. It doesn't just make you feel better. They are required to take down your calls and your message. So you might not be able to talk to a human being. It's very rare. However, calling can make a difference, and you don't just want to tell them to vote against the AHCA. You want to tell them to support Medicare for all, because if we really want to get away from this threat of Republicans taking away healthcare, we can only do that by moving to a single-payer system. And so long as we have the Affordable Care Act, Republicans will always want to attack it. And even though the ACA has a majority of support when you look at public opinion polls, if we pass single-payer, they will never be able to touch it, because that will be overwhelmingly popular. If you poll people when it comes to Social Security, the American people love Social Security. These types of so-called socialist programs, they are overwhelmingly popular. And if you think Republicans are dumb enough to touch a single-payer system after we have it, they're not. I know they're dumb. I know that they are the party of death and destruction, but even they're not dumb enough to touch it. And this is why they've been unable to privatize Social Security, even though Wall Street has been salivating over it for decades. It's because it's overwhelmingly popular, and there will be a huge political price to pay if you are the party that America knows cut their Social Security. And that would be the case if you are the party that took away single-payer healthcare. So Democrats have to get on board with Medicare for all, and you can make a difference by calling them, because Medicare for all is the only way to go.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.